Welcome to Let's Connect Greater Portland, a show about the changes and challenges we face and the great things that people are doing to make Greater Portland a fantastic place to live, work, and play. I'm Christina Egan, your host. Today, we're following up last week's episode in which Tom Bell interviewed Amber Lesperance, who is living in a tent in an encampment in Portland, and Rachel Ohm, a Portland Press Herald reporter who has been covering homelessness. Today, I'm here with three people who are leading the way on solutions, which is what we're going to focus on today. What are the solutions to helping people who are experiencing homelessness? First, I have Brian Townsend. He's the Executive Director of CommonSpace, a nonprofit focused on recovery. Welcome, Brian.
Thanks, Christina. It's good to be here.
It's great to have you. We also have Cullen Ryan, who's the Executive Director of Community Housing of Maine, often called CHOM, and a housing developer who's housing some of the most vulnerable people that we have in our community. Welcome, Cullen.
Thank you, Christina. It's a pleasure being here.
And last but not least, we have Dean Klein, and he is a consultant who works with governments and nonprofits in homelessness. And I had the pleasure of meeting him a few months ago when he moved to Maine and is after doing some great work in Fairfax County on homelessness. Welcome, Dean.
Thank you so much, Christina.
Great to have you all here today. So today I want to start with you, Cullen, and we'll start with causes. There are people that have who are experiencing homelessness right now for a variety of reasons. Can you kind of lay it out for us about who's out there and why they are unhoused right now?
Sure. Well, it's a complex issue. The two common denominators are a lack of housing. We really don't have a sufficient supply of affordable housing, and people are getting more and more boxed out from that. And poverty. People can't afford to live in that housing that's available. So those are two primary drivers. But I think it's best to look at really 5 distinct populations and understand homelessness that way instead of trying to think of it as one big thing. So half of homelessness are adult singles, and that's a significant group. And they're divided into 2 groups, and I'll get back to that. But the next group are families, and then there are victims of domestic violence. And then young people, people under the age of 18, unaccompanied youth. And let's start with youth. So youth are, people know youth sometimes run away. There are challenges at home. And now things are just getting even more complex. And we're seeing a whole range of complexities from gender identity and, people accepting people and so people are not feeling safe at home and getting out of there. But thankfully, most of those youth can be reunited with their families. A small percentage can't and really need to be emancipated, and that we know how to do that with transitional housing and support. Families are largely circumstantially homeless. This is that one paycheck away from homelessness situation, and 90% of families, that's the circumstance. If we can get affordability for housing to them, a rental subsidy or a general assistance, generally that homelessness gets solved rather quickly. And a small percentage, it's more complex than that. Serious and persistent mental illness or substance use disorder at the head of the household. Victims of domestic violence, we've had that for a long time. We know very well what to do with that population. They need 2 years of support to really learn how to have successful relationships and to avoid people who want to abuse them and take advantage of that. That's a rebuilding. It's a moving away from past patterns and getting stable in a new way. But it also involves leaving everything behind. So that's somebody who has really nothing often. And then the adult singles. Most adult singles are circumstantially homeless, much like families. It's a person who has fallen on a difficult time, blown out of a relationship, have no place to go.
Like a divorce or something like that.
Often homeless just for a day or two. In fact, for the last 25 years, our largest shelter in Maine, 1/3 of that population was homeless for 1 to 3 days.
Oh, so
most around 1 day.
Very quickly resolved.
That's right, in and out. And then probably the most visible population is that small percentage of people who are chronically homeless, and that are generally adult singles and people who have a bunch of system failures that surround them. People with serious and persistent mental illness, our system has not served them well. People with substance use disorder, we've lacked support services for that population. And people with traumatic brain injury. And that population, we know exactly what to do with them, and they actually have very excellent outcomes. And it's getting them into housing with permanent support.
Great. And we're going to dive even deeper into that solution of that kind of supportive housing in a moment. But Brian, I'd like to ask you to weigh in on some of the substance use issues that are out there as one of the causes for persistent homelessness. Can you tell us a little bit about what you experience at CommonSpace?
Sure. These are, of course, really broad, questions, and with a great deal of complexity, as Cullen said. The more you look at some of the specific issues, the more you sort of look away from all the very specific individuals who are experiencing their version of homelessness and also their version of addiction or substance use disorder and challenges related to that. It is for sure, listening to Cullen, you sort of break down those, different types of homelessness that we see. There's a theme of substance use that absolutely cuts across all those sectors, but then interacts very, differently within each sector. But if we look at sort of the most visible face of homelessness that we have right now, substance use is absolutely one of the exacerbating factors. It's one of the perpetuating factors. It's one of the causal factors. We have a long-standing issue, obviously, with substances and addiction in this country, in the state, in the city. That's not new in and of itself. There's a lot that's quite new, though, in terms of the types of substances being used, the volume at which they're being used. There's always a risk of overgeneralizing and oversimplifying, but it's also sometimes kind of necessary to get a grasp on what's happening. And, we certainly had this sort of double impact of the COVID pandemic and the opioid epidemic, which had several phases and actually is much more of a polysubstance epidemic at this point, that have coincided with a lot of economic factors that we'll definitely be touching on in this conversation around housing and wages and everything else, to result in really sort of an experience of hopelessness that is, I think, experienced by a lot of people at this point.
Yeah. And it is important to remember that every single one of the people experiencing homelessness is an individual with a particular history. And I've heard you speak about this before, and I've heard others kind of say, oh, well, it's their own fault. They're the ones that got addicted. So I know that it's a disease. Could you humanize this a little bit for us so that we don't think of people experiencing homelessness as other than all of us?
I'm really glad that Cullen identified, system failures, and that's applicable to community systems, family systems, government systems. When we engage with the folks who are experiencing unsheltered homelessness and experiencing substance use, almost across the board, we're looking at people who were damaged children, hurt children, who then fell into varying degrees of other types of system failure that didn't support them in finding solutions early. So we have a community that has a preponderant number of people who have early childhood traumas now compounded by the layered traumas associated with being homeless and with substance use, and watching people that they care about who are in their networks suffer from the same fates, dangers, the safety issues that go with living outdoors or just being homeless in general.
Yeah.
That's our community right now, unfortunately.
Yeah. And Dean, I'm going to turn to you in just a moment to kind of help us pivot to solutions. But I want to remind everybody that you're listening to Let's Connect Greater Portland, a show about the issues we face in Greater Portland. Today we're talking about homelessness with Dean Klein, Cullen Ryan, and Brian Townsend. If you'd like to join the conversation, give us a call at 207-780-4909. Again, that's 780-4909. So, Dean, you were kind of the czar of homelessness in Fairfax County for a while, and you had some great success in helping people get off the streets and into housing that could help them stabilize and improve their lives. Can you give us the broad framework of what are some of the solutions out there that really worked in Fairfax County?
Sure. Good morning again. I would start off with the concept of the importance of a plan. Having a broad plan that includes not only services, but housing, includes all of the key nonprofit partners, government partners, state funding, local funding, and federal funding, and specific and tangible outcomes that guide your work is really critical. In Fairfax, we had a 10-year plan to prevent and end homelessness.
Prevent and end.
Yes.
Yes,
and
ambitious.
That was a key factor that we talked about a lot, was that it's not only about, on the front end, preventing and diverting individuals and families from becoming homeless, but also ending homelessness. And so it's a concept that's really sort of sticks with me. But the plan really helped guide our work, and within our community's plan was a community partnership that included a new office to prevent and end homelessness that was embedded in government. And so that office started off with one individual, myself, and we grew to 28 individuals by identifying individuals within government that we moved into this office to align the services, to align the approach, the outcomes, and to better serve individuals and families in the system. We also aligned all of our data. We recognize the importance of really not only collecting data, but using data to make purposeful decisions and to drive our work. So that included a homeless management information system that was moved in.
So you could track every individual?
We could. We tracked individuals that were homeless. We had all of our, 28 or 29 homeless organizations and county agencies inputting information in. We used that data to direct us in how we allocated resources within our continuum, within our community. It helped us to identify where our gaps were, what things we were doing, not as effective. We looked at the data to better understand how long individuals were staying in shelters, recognizing that without throughput,
meaning getting people out of the shelters into
right,
permanent housing.
Without moving them through the shelters, stabilizing them in shelters when they were in crisis, and moving them to housing, that we would have a system where we wouldn't have any available resource for individuals who were in crisis. So we shortened our length of stay for homeless families by half.
Wow.
We eliminated the use of motels that we had been using because we had no available shelter space and housing
something that we've been doing
resources.
in this area for quite a while.
And that was our only option because we didn't want families and individuals sleeping on the streets. So we used motels, but we recognized that with the increase in affordable housing options, by increasing the flow of individuals through the system, by diverting people, by really becoming more effective in keeping people in their homes. What does it really take for an individual or a family to stay in their home? In identifying prevention dollars that would allow that to happen before they became homeless. By increasing resources for those in treatment, mental health, greater access to health care.
Sounds like a very comprehensive approach, and that we don't really have a plan like that here, do we?
Actually, we do.
Oh, we do?
Yes.
Tell us about it.
Maine has a plan to end and prevent homelessness that was developed by the statewide homeless council, but really with everybody involved. The regional homeless councils, the continuum of care, it started in 2007. It was revised in 2011 and again in 2019. It has much of the same qualities of a dean. But in Maine, we actually have been looking at homelessness from a whole state perspective. So rather than just a county, we've been trying to get the whole state to get on the same page as to how to do it.
I have a feeling Maine is probably the same population as the county of Fairfax.
It is. It's about the same population, individuals.
Yeah. But it makes sense to have something statewide, since we know that homeless individuals are migrating between different municipalities and throughout the regions.
That's exactly right. And I think that what Dean talked about, I think our plan lacked some of the data, and we did have data, but we're moving in the state of Maine towards a hub model that allows us to collect data about what's working locally in 9 regions, and then have a comparative analysis so we can draw from best practices. So we're actually on track to be doing much of what Dean was helping to lead in Fairfax County in Maine as a whole state.
That's good to hear. Let's talk a little bit about the new Homeless Services Center that just opened up in Portland. Who would like to start and talk about what it's providing and how it's improving people's lives? Brian, would you like to
Sure,
take that?
I'm happy to jump into that. It's so the Homeless Services Center opened after a lot of work to get there, to get it constructed and built. Several years, in fact, of from the idea stage to realization. And so that's a city-operated shelter with 208 beds, I believe, at this current moment. And they opened in April. So they're just several months into their operations, and it's been like a lot of our community recently. It's sort of an unpredictable course, just because things have been changing almost month to month
At
in
the
the
shelter?
community, at the shelter, and in our
And the
community.
Yep.
So in terms of the intended use of the shelter, I think this might be well known, but out of the gate, it has been primarily utilized by individual asylum seeking people, and just because there's need in multiple directions at this point for shelter in the city, and so as of the last month or two, it's now about a 50% reduction in that. So there's sort of 50% use by asylum seeking individuals and 50% by more sort of native homeless population. And out of the gate, one thing that I've observed, because I sit on the advisory committee, is the staff involved have been very proactive about responding to initial challenges, because it's a new system.
Mm-hmm.
It's also I think it's worth to say that the Homeless Service Center itself is a really significant departure from what the city used to hold as its emergency shelter,
Which was
at Oxford Street.
Oxford Street, yep.
Which was in a very did not have ample space
Yep.
or capacity to support
Yep.
people experiencing homelessness in a more holistic, wraparound way, which is the whole design of the Homeless Services Centers, to have everything that they need on site, including housing supports, including food, including a health clinic, and the ability for all the partners who work with the city to come in and be part of the support system there.
And Brian, we've been reading in the press that some of the folks that are experiencing homelessness have said that they don't want to go to the shelter because the rules are too strict or they don't feel comfortable. You've mentioned that the staff has kind of been trying to address some of those challenges. Can you tell us a little bit about that?
Yeah, I think that part of the problem is it is new, and there's historical familiarity with a system that doesn't exist anymore, and there's some assumption that maybe that there's a carryover, when in fact there's an imperfect but quite impressive and significant sort of change in model, and the way that people are being supported at the Homeless Service Center just looks and feels very different.
So everybody has to get used to that, to understand that it's a different form of service.
That's true, and I think that again there are some lingering sort of mythologies, honestly, around that. Which is not to say that everything is perfect, but I think that most important element is there, where they're continuing to listen really acutely to the guests at the shelter and making changes. We've seen that almost month to month. We've seen adjustments to transportation schedules, to check-in and check-out rules, and various things that people have presumed would be limitations to them coming in.
I have got a caller who has a question. This person is a veteran of the Army from Freeport, Maine, and they wanted to ask whether any of you can speak to the number of U.S. veterans who are unhoused in our area. And I'll add my own. If you don't know the precise number, what are some of the challenges that veterans specifically face being unhoused?
I can answer that.
Thank you, Cullen.
So Maine is fortunate to have really what is a finite number of people experience homelessness altogether. We have about 5,200 people right now experience homelessness through homeless management information data. And there are two populations that are rather small comparatively, and those are chronically homeless adults and homeless veterans. And there have been some resources that have come on a federal level to support homeless veterans in particular, and that's allowed us to cut our numbers of people experiencing homelessness amongst the veteran population more than in half across the whole country. In some places, getting it down to functional zero. And in Maine, we were down to below 100 people prior to the pandemic, which really changed a lot of things around homelessness. We got back up to about 200 people or so who experienced homelessness amongst veterans. And right now we're in the middle, right about exactly in the middle of a 100-day push to house 100 veterans. And those pushes have been very successful because what helps us end homelessness is when everybody is working together, all pushing in the same direction, and it's exactly what's happening. There are resources going right to homeless veterans to get them housed. And so those include three primary things: permanent supportive housing model, a rapid rehousing model, and then a short-term transitional housing that usually gets people into either of the other two, but stabilizes them. So there are a lot of resources thanks to Congress and its continued allocation towards that. And it only also proves that when we have the resources, we can end homelessness for a population.
Thank you, Colin. And thanks to the caller from Freeport who called in. It was a great question. So let's talk a little bit. We've talked a little bit about the shelter. It's an emergency solution. Some of the medium and longer term solutions. And Dean, I'd like to ask you just a little bit about the kind of medium term, and then Colin, I'd like to ask you to talk a little bit about supportive housing, which the Community Housing of Maine does such a great job on. So, Dean, do you want to speak a little bit to that?
Sure. There are a variety of sort of shorter term, medium term, housing options. Some might be transitional housing. Some might be.
Can you define what transitional housing is? It
Transitional
sounds a little wonky.
Yeah, that tends to be a 2-year housing program with pretty intensive supportive services. The idea is to really provide a high level of services to the individual or families during that period of time to allow them to then transition to permanent housing.
So it kind of stabilizes them, provides the wraparound they need in order to move into permanent.
Might include education or employment supports or things like that might take longer. So a 2-year period of supports along with housing where they're oftentimes contributing 30% of their income during that period of time. It's operated oftentimes by nonprofit organizations in the community.
So that's a perfect transition to you, Cullen, a nonprofit and community organization.
Sure. So, and as Dean said, transitional housing tends to work really well for three distinct populations. Those are homeless youth who really need to rebuild their lives and start from scratch. A lot of support, usually a permanent rental subsidy. Victims of domestic violence who, again, are rebuilding their lives from a past pattern to a new pattern that's successful. And also people in recovery from substance use disorder. Again, moving away from past patterns, developing new ones, building a support network that goes with that, and then going on to success. So those are really good. The other type of housing we've zeroed in on is permanent supportive housing. And this essentially is somebody who has a rental subsidy to support them in the long term, and then supports that will wrap around them commensurate with need. And we've had problems with having enough support services to wrap around people commensurate with need. And that is actually, thankfully, going to be fixed from a piece of legislation that was signed into law this summer that will help with housing first resources. But the neat thing about permanent supportive housing is that it really works, and it works in all of its forms. And it makes sense. If you take somebody who has, let's say, serious and persistent mental illness, all of their symptoms, being psychotic or whatever else, are all exacerbated by stress. When you take somebody who's in chronic homelessness, that's arguably the most stressful situation that a person can be in. So we see people when they're chronically homeless, floridly psychotic, using substances, not doing well at all. When we move that person to housing and we say, you just get to live right here for the rest of your life, we watch physiologically the stress gets subtracted and we watch people clear of their symptoms. They do well just from being stabilized. And then when we add support services and make sure people are continuing to do well, they do well. And we have about a 90% success rate with all these models, which generally wrap around housing first, which is don't wait for people to get well while they're in the middle of homelessness. Move them into housing and then support them in staying well. And that's a far better approach than waiting for people to somehow get well when they're in the middle of homelessness.
This is something that I've learned from you, Cullen, over the years, that this housing first approach of getting people stabilized in housing really works. It also saves money from the public sector perspective, right?
It does. So this very population, small as they are, probably 300 people or so in Maine right now, they account for the lion's share of our emergency expenses. They're essentially ricocheting through our most expensive emergency systems all the time. In fact, we've got a group in Portland that's been working for 8.5 years, 20 organizations wrapping around the populations, figuring out who's doing what to get the person housed, who's doing what to keep them housed. we've figured out by looking at data over the last 2.5 years that the same population, the only difference is whether they're housed or not. Same population is up to 29 times, not 29%, but 29 times more likely to be in the hospital when unhoused than when housed, and up to 45 times more likely to be in jail when unhoused than when housed.
Those are very costly places to be.
Very expensive.
So we have so little time, and it's just been so great talking with the three of you. I could go on for hours with you, but I am going to transition to rapid fire questions here. And it does sound to me like there are solutions out there that we really shouldn't be just throwing up our hands and saying this is going to be a persistent problem forever. If you could wave your magic wand, what's the one thing that you would do to try to help people who are experiencing homelessness? Brian?
Okay, this is
short.
I'm using my wand.
Yep.
Short. I would do something to just change an essential quality that a lot of us have quickly, which would be to really reduce the element of fear that we carry and increase the amount of curiosity and openness to sort of exploring relationships.
Love that. Compassion. Dean?
My suggestion, I know, is a long-term one because housing takes a long time to make happen. But finding housing solutions, whether they're short-term or long-term, and being able to place people into shelter and housing as quickly as possible, I think is a key factor.
Mine includes housing, and also getting all the systems to be aligned and pushing in the same directions. We have silos, and it's complicated. And if we can get everyone working together, we can end homelessness.
So you're so good on that. I'm going to give you one more rapid fire, which is what can people that are regular residents in the greater Portland area, what can they do?
I would start by saying get involved, become more educated in understanding of what the population is. Yes, we're seeing an increase in the encampments and the individuals who are living outside and figuring out solutions for each individual one at a time or collectively, but then also understanding the broader ways that they might be able to get involved with volunteering.
Brian, you already kind of answered this, but do you want to add?
Yeah, I tend to think of the intersections in our community, like the literal intersections where folks are often asking for support.
Yeah,
That's pretty
people
symbolic.
on the road.
Yeah, as very symbolic of just the intersections we actually have with our community members elsewhere, and just being thoughtful and intentional about those. There's not one right thing to do or not do, but just to really lean into those.
Love that. My brother gives out granola bars. And Cullen?
I would say be kind and considerate. As Brian did such a nice job of explaining, people have experienced trauma and huge challenges. And in this country, we have them on display for us at their worst possible times. Know that that's a person that is going to be a lot better once in housed, and welcome them into your neighborhood by saying, we need housing and let's have it here.
Oh, that's a great one to end on. Thank you, Cullen. Thank you, Dean. Thank you, Brian. Thank you so much for being here today.
Thank you.
Thank you.
And I also want to thank Joshua, who's our sound engineer, and WMPG, who collaborates with the Greater Portland Council of Governments in producing this show. You can reach us on Instagram at Let's Connect Radio. Join us next week for another conversation about the great work that's happening in our communities. In fact, next week we've got the mayoral candidates on, so tune in for that. Until then, be kind to yourself and to each other. I'm Christina Egan. See you next time on Let's Connect Greater Portland.